In our politics lead right now, lawmakers in the House of Representatives, as you see right there, are taking their last key step required before voting on legislation that would end this historic government shutdown. And maybe this should be breaking news, too. We have discovered that bipartisanship is not dead. It is alive and well. And let's talk about that with Democratic Representative Sam Liccardo and Republican Representative Kevin Kiley, both from California. They just voted. They both represent California, and they are introducing a bipartisan bill to extend these Obamacare premium tax credits for 2 years that has been, for the Democrats at least, part of this debate. Congressman Kiley, is there a sense of urgency among Republicans, or at least enough Republicans, to pass legislation to do something about keeping health care costs affordable for constituents?
I think there is. There's a lot of folks on our side of the aisle who are extremely concerned about the prospect of this massive increase in premiums for a lot of our constituents. And so you've had a number who have come out publicly and said that they want to see some form of temporary relief. And I think that the proposal that Congressman Liccardo and I are offering is a great compromise because it provides this temporary time-limited extension, but it does so in a way that actually has reforms such that we don't increase the deficit in the process.
And just to give an update on what's going on the right side of your screen, folks at home, the rule has passed, and now it is an open for debate. So they're going to be debating this bill, this legislation, for an hour, and then there will be a vote on this legislation. It is expected to pass, although it's narrow. It's a narrow majority the Republicans have. Back to this bipartisan legislation, Congressman Liccardo, walk us through the basic outline of your bill. Who would it affect and how?
Well, Jake, as Kevin described, this would extend the tax credits for 2 years. So the 22 million Americans who would otherwise see their premiums double will at least have those concerns squarely addressed. But it finds savings in a couple of different ways. We borrowed from both Republican and Democratic ideas, a bill from Senator Cassidy in the Senate that would help go at the very high reimbursements that insurance companies are getting from Medicare Advantage. We think a lot of upcoding, an awful lot of studies been done that insurance companies are really gilding the lily from the taxpayers on upcoding. And so getting at those abuses is critical and can save a lot of money. The Congressional Budget Office said about $124 billion over 10 years. And then we're going to go after broker fraud as well with a proposal that came from a Democrat colleague, Deborah Ross.
Congressman Kiley, unlike other proposals, you include a plan to pay for this extension by reforming Medicare Advantage by eliminating something called upcoding, which your colleague just referred to. Can you explain more about what that would work and what upcoding is?
Yeah, and importantly, this reform is actually supported by the AARP, and it's estimated that this could save $120+ billion over the course of 10 years. The basic idea is that with Medicare Advantage, the sickness of the patient is what determines the amount that the insurance company gets paid, and there's been a lot of abuse or inaccuracies in this process, such that the patient is initially classified in a way that doesn't reflect their actual diagnosis, and so that means excessive money goes from the public treasury to the insurance companies. So this is also a good answer for those who say they don't like the extension of the premiums because the tax credits they go directly to the insurers. This sort of balances that out as well. In addition to, as we've been talking about, our other reforms in addition to this make this fully paid for over the course of the 2-year extension.
Congressman Liccardo, one of the talking points we often hear is that insurance premiums are going up because of undocumented immigrants. What is the reality behind that claim?
Well, undocumented immigrants cannot purchase insurance on the ACA exchanges. They never have been able to. They cannot do so now. So that argument is obviously specious with regard to this particular issue. Yes, in some states there are public dollars that undocumented immigrants can take advantage of, but that has nothing to do with the extension of these ACA tax credits.
Congressman Kevin Kiley and Sam Liccardo, thank you so much.